1, 2, 3, 4, 5. Servings of fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. Let's go play outside. Tiger it, my turn to hide. 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day, let's have fun the healthy way. 5, 4, 3, 2, 1.
Okay. Hi, everyone, and welcome to Pediatric Echo for childhood obesity. And we have Sky Kershner back with us today. He did the last Echo with us on motivational interviewing. And remember, Sky's claim to fame is being on the Hoarders.
Not my house.
Not your house. Not your house. You know, he was he really got to practice his motivational interviewing skills for that opportunity. And he is also one of the only folks we know that is certified by the MIT Network, which is the Motivational Interviewing Network of Trainers. Almost got it right. Okay, so we are not going to go over everything that we did last time, but we will be doing some review. And last time we really got into the MI spirit and what MI was. We went over some of the basic skills as far as asking permission and the reflections, and we'll briefly overview some of that today. And then we talked quite a bit about the MI flow, which we also will go over briefly. And then for today, we're going to do a lot of role playing at the end, which I guess we're going to be doing the role playing to really hone in and practice some of those advanced MI skills. So I think you were going to start with a video today.
We're going to do a couple slides because I want to remind you of the most important concept, the key concept. So Jason, if you could bring the slides up, do I need to hit this? There we go. So, so the key concept is that what you say to your patient as the provider only counts 1 point. It only counts 1 motivation point. And this is the hardest thing to get the hang of because we're used as providers, we've got all this education, we've got all this knowledge, we have all these opinions. We're used to thinking that what we say to the person is the most important thing. But all the research in motivational interviewing says, no, the most important thing is what the client hears themselves say. Let's go back there. So what you say to the person counts 1 point. What they hear themselves say counts 1,000 points. And just as a way to exemplify this, I wanted to show a short tape of what I call the encouraging doctor. And let's just notice, I want you to notice who says what. The reason what the person, and this is true for any of us, what we hear ourselves say means more to us than what other people say to us. This is why nagging doesn't work. Have you noticed that?
Oh my gosh, that nagging doesn't work.
Because when
except in the grocery store checkout line.
when you nag somebody and they come back and counter it, they hear themselves say the counter argument. And that counter argument embeds more strongly than what you said. What you said to them just bounces off.
Because that becomes their self-talk to themselves.
Exactly. What we hear ourselves say is more believable to us than what other people say to us, even when you have authority like you're a physician or a provider of some kind. So let's watch the tape, and I just want you to notice who's saying what. And when the patient hears, what is happening when the patient hears himself say whatever the patient says. So let's see the video. And all right, what do I need to do to get that to play? There we go. not a good time for me, right? So what did you notice happening there, right? The doctor is concerned. The doctor knows this patient well, right? He says it won't be as hard as when you gave up smoking the last time. Remember, you lost your job and that was stressful and all that.
Mm-hmm.
But what do you notice about what the patient hears himself say? The patient hears himself say 5 or 6 or 7 times, I'm not a customer for this. The doctor, no matter how much he cares, and look at this. So if we look at communication in healthcare, this was a study done across the board. Most of the time, providers spend 70% of the session informing the patient about healthy habits, what they should do, what they need to do. Usually the first part of the interview has to, or of the meeting with the patient has to do with asking a bunch of questions. Then once you've got the data you need, you just start informing, and very little listening. So in motivational interviewing, we need to flip this around. We want more listening. We want more asking. We want the patient to inform themselves rather than us to inform them. Because you saw what happened in that video. Every time the doctor tried to give him good information, the information wasn't bad, it's excellent information. It's just bouncing off because the patient is not a customer for it. So you all did amazing with the Zoom poll last time. There's going to be a post test after this. I want to do a little exercise with Jamie here. We call this dropping the rope. And part of the reason, or part of the way that motivational interviewing works, is that we want to create a sense of safety in the conversation. We don't want the patient to become amygdala activated. Why? Because if the patients, you remember, the amygdala activation is fight or flight. When the amygdala gets activated, the prefrontal cortex goes offline. When the prefrontal cortex goes offline, the client isn't able to think. They're spending all their resource defending or trying to get away. What does that look like in a conversation? It looks like the client agreeing with you, right? That's what flight looks like in modern society. I'm just going to yes you to death. I'm going to, yes, doctor, I'll take the prescription, whatever you say. Yes, I'll do it. I'll eat my 5 vegetables. Yes, I'll get more sleep. But then they don't do it. Why? Because they're amygdala activated. Mm-hmm. They're not feeling safety in the conversation. So if we go back to this slide, we want the prefrontal cortex to be online. So we don't want to get engaged in a tug of war. We don't want this to be a fight between us. Mm-hmm. You should eat more vegetables, but I don't like vegetables. You should eat more vegetables, but I don't like vegetables. We want the conflict to be within the patient. What do you think about vegetables? What do you know about vegetables being good for you, and what do you know about them being bad for you? So we ask questions to try to help the conflict be internal rather than between us. So I'm going to do a little practice here with Jamie. This is a little closed fist, open fist. Have you ever done this?
No.
Okay. Nobody's going to get hurt in the making of this. Okay. So,
ready.
So for 2 minutes, and let me get my timer here.
Okay.
So I'm going to want you to do everything you can to hold a fist as tight as you can.
Okay.
And I'm just going to talk with you about it, and I'm going to see what happens if we have a motivational interview. And usually the instruction is, I'm going to try to get you to open your fist.
Okay.
Right? Oh, you already did. So no. Okay. You ready?
No.
Okay. So now we're starting. Okay. So how's your day been going?
Awesome.
Yeah. What's been good about it?
We didn't have any actual Zooms before our Echo today.
So you weren't really busy, or really?
Well, we were busy, but we didn't have to rush from one place to another. So that was awesome.
Yeah. And the Echo today, that's this.
That's right.
This is something you love to do.
Love to do it. Yes.
It's helping folks.
Absolutely.
This
right. This is one of the most important skills ever, right?
Yeah.
For doing the motivational interviewing for providers.
Right. So I'm noticing that you've got your hand in a fist as I asked you to.
Yes.
Yeah. And I'm just kind of wondering, what's your experience of having your hand in the fist like that?
Well, I'm trying to squeeze it really tight because you told me to keep it in a fist.
You're doing a fabulous job too. Yeah. You're really keeping it tight. And what are you liking about having it in this tight fist? What's
I'm not
good about
liking it.
You're not liking it, really? What don't you like about it?
Because I feel relaxed up here, but my fist feels tight.
Yeah, so there's tension there.
There's tension.
Yeah. You're doing it because I asked you to. You like being somebody who's cooperative. You don't, especially. And yet you're doing it still, even though it's uncomfortable for you.
Yeah.
What do you make of that?
I just did it because you told me to, and we're on tape.
Oh, you got the whole world watching. Yeah.
Right.
Right. And so that's interesting. You don't like being somebody who does what people tell them to, and yet here with me you are. What do you make of that? But yeah, I see you're really working hard to hold that. You've got
shaking.
14, you're shaking. Yeah. No, even though it's painful.
Yeah, because
and you don't want to be doing it. You're still
I do not want to be doing it.
Yeah.
I do not.
And what's that like for you?
I'm waiting for my time to be up.
Yeah. You're excellent. Well done, Jamie. Okay, so 2 minutes.
I did 2 minutes.
Yeah, and what was that like to just be holding that, even though you didn't want to be holding it?
I knew it was time limited.
Yeah.
So I knew I could do it.
And what's that value? Is that like a competitive value?
I think so.
Right. So you were going to win.
I was going to do it
to win.
Right.
Yeah.
Because to me that was kind of a challenge.
Yeah. And
my hands still hurt.
Yeah. Right. Well, it's painful.
But that's 2 minutes.
Right. So, I mean, you say, oh, yeah, no problem. I can hold this. But you hold anything tightly.
Right.
It's going to start hurting.
Right. That was my exercise for the day, Sky.
So did you feel like I was trying to get you to do something? You did. What was I? When did you feel like I was trying to get you to, other than ask you to participate?
Toward the end where you were asking me and then you were looking at my fist like, oh, you're going to open it. You're going to have to open it. So I felt that challenge.
Oh, you did. And that was increasing your tightness even more.
Right.
Yeah.
And you even said that once because you said, oh, look, you're even holding it tighter.
Yeah. And before then, when we were just kind of reflecting on your experience, what was that like?
That was even harder because we were having conversation that I like to have and I felt relaxed, but this was tight. So it was conflicting to me.
Yeah. And right, if we had been going on longer, if this had been a 5-minute exercise, you might have at some point said, the hell with it. This isn't worth it.
I just can't do it. I can't focus on keeping my fists tight and answering your questions, especially questions that I have to think about.
Yeah. So if you want to practice some fun MI at home, you might ask one of your family members or a friend or a partner or someone to hold their fist and just try different ways to motivate them to let it go. And you might notice pretty quickly, now sometimes people say, well, if I had $10 here, what will motivate you to let this go? And that's what we're looking at. So we've got these habits, we've got these behaviors that we kind of know are hurting us, and yet we keep doing them anyway for whatever reasons. And probably a good question. It might have been a good question if I had said, so what's motivating you to keep it so tight? How do you understand your motivation right now to want to either win or whatever it is? And that's what we're trying to do with motivational interviewing. We're asking about what's the motivation behind the behavior you're doing, even though the behavior is uncomfortable for you. So whether we're talking about addictions or healthy eating or other healthy habits, it's the same model. So let's go to the next slide. So this is the standard 4 processes of motivational interviewing: engaging, focusing, evoking, and planning. And engaging was kind of what I was doing when I was asking Jamie how her day was going, just starting off, on the shallow end. All of motivational interviewing involves strong engagement all the way through. You see, it's the foundation of this staircase. And then, focusing, I started bringing her attention to to her hand. I wasn't getting much change talk, although she was saying it was painful. It's starting to shake. She's not enjoying it. And then just kind of playing around with that. I like to think of these 4 processes as running a baseball diamond. So you see down at home plate, and 80% of motivational interviewing is at home plate with engaging and connecting. So the client, the patient is saying things. That's like the pitcher pitching the ball. Sometimes it's a softball, sometimes it's a hard ball. Sometimes they try to hit you with the ball. That's not fun, right? And your job is to just hit the ball back, to just reflect back what they're saying and hit it back. To get to first base, and we want to run the bases in order. To get to first base, you know, we're going to have a focus. So if we're talking about obesity, we've got the 5, 2, 3, 2, 1.
No. 5, 2, 1,
5, 2, 1,
0.
0.
We're going to have to make you do the song later.
We've got the 5, 2, 1, 0. I need the t-shirt. We've got the 5, 2, 1. So that's a focus. So, you know, like a question about, can you name 5 vegetables? Right? That would be a focusing kind of question. And we might notice ambiguity. So we saw with Jamie, you know, how does that feel? Well, it feels uncomfortable. The rest of my body's calm, but this hurts. So there's an ambiguity, right? And you even said several times, I don't normally like to do what people tell me to do. Yet here I am doing what you told me to do.
Because it was a challenge, right?
Yeah, and that competitive. Oh, there it is. Okay. So that would be the first base skill. And so the focus is because of this topic, the focus is pretty obvious. You know, we're talking about health, we're talking about
physical activity,
nutrition, all the things related to weight, obesity, being healthy. So you've already got your focus kind of laid out for you. The patient's expecting that focus. The second base skills are where motivation is the central topic. We call this evoking. The skill is evoking. And we're encouraging change talk. What is change talk? Change talk is anything the patient says that's moving in the direction of them making a healthy or positive change. So when Jamie says, my fist is getting tighter and it's uncomfortable, that's change talk. That's the pain of what she's doing. If the kid says, you know, I can't run as fast as my brother, and I used to be able to beat him, but now I can't anymore, that's change talk, because that's the pain of the status quo. Mm-hmm. Change talk has to do with either my dream of what I want to have happen, I want to be able to play on the soccer team, or the pain of the status quo. Planning is the last thing we do with motivational interviewing. The thing I find most often that happens in healthcare is that folks want to go from home plate to third base. You can't steal third base. You'll be called out almost immediately. There are other models like the intervention model, which would say, you know, here's what you should do. You've got this problem. The smoking's hurting your lungs. You should stop, right? So that's, you know, noticing the problem. I'm telling you what the problem is, and then I'm telling you what you need to do.
Which is traditionally how we've done it, right?
Right.
Eat better, move more. And I just always say to the providers that we train, how's that working for you with your patients? And the answer, obviously, well, it's not. So that's why we have to learn this additional skill to help our patients.
Right. The research shows we can be 3 times more effective with the clients actually engaging with the treatment plan,
right,
than giving it lip service, walking out and not doing anything with it, and then coming back and having the same conversation over again.
And I love how you said that we as providers usually do try to steal third,
right,
and go straight.
We might try to steal third from home plate. We might try to steal third from first base. But if you do that, you're missing the power of motivational interviewing. If we go back to the home plate side again, if we think about home as who are you? I want to get to know this person. First base is the question of what? What are we going to talk about? And I think in the handout that I hand out last time, this was kind of outlined.
Okay.
The second base skill is the question of why. Why eating so much junk food? What do you like about junk food? Is there anything you don't like about it? What do you like about holding that fist? Is there anything you don't like about it? Well, I like beating you, Sky. I want to win. I can do anything for 2 minutes, no matter how bad it hurts. And at the same time, it does hurt, and I'm not enjoying it. So That's what we mean by ambivalence. We want to spot the ambivalence. And usually we start with, what do you like about the status quo? What do you like about not eating any vegetables? Well, I love French fries. Yeah. What do you love about French fries? Well, they're salty. Oh, yeah, that salt is really good, right? And they're greasy, right? And that feels good. Yeah. And is there anything you don't like about it? And then we kind of just test the waters and see. Sometimes people will say, no, I love everything about French fries. There's nothing bad about French fries, right? But other people might say, well, mom gets on me about it. Or I have to come in here and have you,
French fries.
have you yell at me about it.
Oh.
So once we've got some ambiguity, then we can start looking at change talk and, what is their motivation to be healthier? Are they a customer to being healthier? Right? We kind of assume that because they're coming to see the doctor, they're a customer for being healthier, but that might not be the case.
Especially when you're dealing with pediatrics, right?
Right.
Because there are multiple agendas in the room with the parents or caregivers and the child. So
Yes.
A lot of times that is another curveball.
Yes, right. So the multiple agendas and who's here for what and why is it important that you came today? So I've got my Medicare supplemental thing sent me a thing. It said, if you have your home health care visit, we'll give you a gift card for $25. What's my agenda? That gift card.
That's right.
Right?
Yeah.
I'm not having that meeting for my health.
That's right.
No.
That's right.
Stuff
That's
is going to happen.
That's the carrot.
That's the
right?
carrot. Right?
We prefer carrots over sticks.
And then if it's going well, the plan will emerge. Usually spontaneous on its own. Sometimes I might evoke it by saying something like, well, given everything we've talked about, what do you think about this? Or what changes if you wanted to make a change? And I might even float it hypothetically. If you wanted to make a change, what changes would you make? And what would you start with? And you see the bubble on the third base guy. What am I willing to do? Not so much the plan that's given to me by the provider, but what does the patient themselves say? And again, what the patients themselves say is the most important thing. Really, motivational interviewing is a little bit like climbing a hill. We kind of slog up the first part with the evoking and engaging and just staying with the client. You see the word darn, that has to do with darn cat. DARN stands for desires, ability, reasons, and needs. Needs meaning urgency. How urgent does this feel for the person? We want to evoke this change talk. And once we've hit the top, it's much easier to go downhill, talking about what are they willing to commit to doing. That's the cat. So we've got darn cats, and the cat is the commitment talk. So let's just review the skills. The ORS skills: affirming the client, asking one or two good questions. What do you think about this? What do you think about your eating? What do you think about your health? What's important to you about being healthy? These kind of open-ended questions. They're not yes or no questions. We're not driving to. We're not leading the witness. We don't want them to have the feeling that they're on the witness stand being cross-examined. The reflecting skills is probably the most important because this is what reduces the amygdala, helps the client feel understood. And I have the word "and" in there because the double-sided reflection is probably the most impactful of all the kinds of reflections. So on the one hand, you really want to win, and on the other hand, at the same time, your fist is hurting. And you're starting to shake, and you see it's causing you pain and discomfort. So both are true. So a double-sided reflection is lifting up both sides and always joining them with the word "and." We usually don't. So if the client says, "I know eating healthy is important, I just don't have the time," I wouldn't use the word "but" there. I wouldn't say, eating's important, but you don't have the time. I would say, eating's important, and at the same time, you don't have the time. So you're not quite sure how you're going to manage these two things. And, we might have a conversation about, so you say, it's important to eat healthy. What's important for you about eating healthy? Not what does the research show that I'm going to tell you, but why do you say that? Why do you say that about yourself? Affirming autonomy, we always want the client to know this is their life. It's not our life. I'm not, so we say, I want to resist the fix. I want to resist the desire to fix you. That's more the intervention approach. So I'm going to affirm, this is your choice. This is your life. I've got information that might be helpful. We could look at that information. What do you think about the information? What do you think about the idea that vegetables will probably be healthier to your body than French fries? What do you think about that piece of information I just gave you? Right. So I've got information. I'll give it to you. If you want, I'll ask permission. We talked about that at the last time. Could I give you some information about what we know about French fries? And then it's up to you what you want to do with it. All right. So I think we're ready to move into some things. The ask, offer, ask skills always start by asking. If you want to offer information or an idea or advice, always ask permission first. That's the first ask. The second ask is to see how it lands. How many times are people giving you advice and they don't say, what do you think about the advice I just gave?
All the time.
Right. All the time they ask you. Right. All the time they give you advice. Right. Especially if you're a new mother, a new parent.
Oh.
Strangers coming up, telling you all sorts of parenting skills. And then they don't stay around to say, what do you think of the advice I just gave you? And you might say, well, I tried that last week and it didn't work. Right. Sometimes I think, if you imagine putting on different hats, I might say, as a parent, I get what you're saying. Fast food is so convenient and the kids scream for it. And sometimes it's the only way to give them a treat. And at the same time, as you're a physician, I want you to know eating fast food every day is probably harming your child's body. Mm-hmm. What do you think about that piece of information? So again, I don't want to be in a power struggle with the parent. I want to give the information and say, what do you think about that research?
That's right.
Right. So it's not a fight with me.
Mm-hmm. You got to get on the same side of the fence.
Right. Yeah. Here's what that chart says. Mm-hmm. Do you believe it? Mm-hmm. And some people say, well, that's fake news. Right.
Right. And I think that is an excellent point, especially for the providers that take care of pediatrics when you're dealing with those multiple agendas in the room, because it's so funny, in my experience, if the child has a problem with their weight and their growth versus if they have an abnormal lab. Because when we have an abnormal lab and we're looking at that lab like a cholesterol, we're talking about the cholesterol and what can I do to make the cholesterol better. Whereas when we're talking about obesity, there's that shame and stigma that comes along with that. And it's so much easier to talk about cholesterol. That's why I think we should rename obesity.
What would you name it?
At first I thought diabesity, but it's too...
Oh, that's clever.
It's too much like obesity. Right now I use growth. There's abnormal growth here. So we've got to figure out what's going on with your metabolism and make metabolism the bad guy. So they're not. Make metabolism the bad guy. So the parent's not.
Yeah.
Right. Yeah. And then now I'm using insulin resistance as that diagnosis. Mm-hmm. So if they do have insulin resistance, which the majority of our patients do now, right? Because of the food environment that you're talking about, because of the increased intake in sugary drinks, and because of the fast food, and because it is so easy.
Yeah.
And often cheaper, right?
Yeah.
So that life of convenience that we have demanded as adults and parents, the big food industry have given it to us, but it's killing our kids.
Yeah.
Yeah.
Yeah. Right. So finding those patient first ways of saying it rather than naming the person as their diagnosis.
Exactly.
So, how do you feel about being the size that you're at?
Or shape.
Yeah, or the shape.
Mhm.
Or how do you feel about being as big? I don't know if big would be
Usually
that might be
not,
a stigmatizing word.
it usually is, but if they say to me,
I'm
I'm just tired of being this big, then I'm going to use big.
Yeah.
But if they're dancing around, I use whatever words they give me, which is part of that reflection, right?
Yeah.
It's reflecting back to them what they say. So you're using their words.
Yeah. And when we think about that first base skill of ambivalence, we can also work against the stigma by saying something about, tell me what you like about being as big as you are.
Oh, I love that.
Right. So now
because it's got advantages.
It's got advantages, right? I'm the biggest, nobody can push me around.
Mm-hmm.
Right. So we would want to give that
the best person on the football team.
Right. My coach loves it. He's giving me gift cards for McDonald's. Right.
Oh.
Right. So because every shape has its pluses and minuses. People say, "Oh, Sky, you're so tall. I'd love to be tall like that." Yeah, you wouldn't love it if you felt how my back feels.
All right. Well, I'll tell you what, and I'm the president of the short club.
Yeah.
And I've got some patients that are like trying to get in, but I'm still president of the short club. And I happen to love it. I didn't always love it.
Right.
But I've grown to love it.
Right. So those kind of disarming questions, when we're at the focusing stage,
and that's first base.
That's first base. We're evoking the ambivalence. So, for example, with smoking, what do you love about smoking? With drinking, we have the same. Anytime there's a stigma, what do you love about using heroin? Well, it numbs me out to my feelings. Right. That's a really good use of it. Right. Is there anything you don't like? Well, I'm in jail, or I'm, whatever it is. Everything has two sides to it. So that's
having them realize the sides. So now, are we going to get into the role playing?
Yeah, let's do that. Yeah, we can do that. So the main question is, just to go back to the slides for a second, what stage of change are they in? Meaning, what are they a customer for? So. We've got these 6 stages of change. Sometimes we think about it as a wheel. Pre-contemplation is, I'm not even thinking that this is a problem. I came in here for this, and you're talking about that, and it kind of annoys me. Yeah. Right. That's when they're trying to hit you with the ball. Contemplate. So that's contemplation is me with flossing, going to the dentist. Okay. Right? I'm not a flosser. I floss 2 days before the dental appointment. Right. Why? Because I don't want to be yelled at. And so I know it's good for me. I know I should be doing it more, but I don't. Right. So I'm ambivalent. This is where motivational interviewing excels. If the person's already in preparation, like I've got the floss, I've got 10 things of floss. You've given me 10 over the past 5 years.
I have it in my desk. I have it in my car.
Everywhere.
I have it everywhere.
But then I discovered those like plastic toothpicks.
Oh, yeah.
Those things are great.
Oh, I know.
Right. So now I bought those, and I actually use them sometimes, because sometimes I don't like the feeling of stuff in my teeth. So like sometimes I'm in action, but I'm not quite in maintenance. So we always want to find out, what's the patient a customer for? So as we enter into this role play, I think we're through with our slides. We're going to see kind of what you're a customer for. Okay. And you've got something personal, right?
I am. I thought that it would be better to use like a real world situation. So I'm going to be an adolescent. I'm going to go back to my adolescent days. Yeah, okay. So I'm an adolescent.
Just see our time. We got plenty of time.
We've got plenty of time. We may even get to do 2. We may even get to do 2 role playing. So I'll just set the stage. I'm going to be an adolescent that previously was very active, ran track, went to the gym every day. And then I went to high school and started taking a lot of AP college classes. And now I just can't find time to exercise. Does that sound reasonable?
As an adult?
No, I'm an adolescent.
Okay.
I thought I was an adolescent.
Yeah, you're fantastic. Yeah.
So I'm going to be that adolescent, and that's kind of the stage. So,
and you're coming into the office to
yep.
And
because guess what? I gained weight, and I'm stressed out.
So you're coming in because of your annual checkup, or are you coming in because you're worried about the weight? See, I want to know what you're a customer. So let me just start with that.
Okay.
So Judy. Okay. It's great to see you. What brings you in today?
Good to see you too. Well, my mom wanted me to come because I've been gaining weight.
So your mom's worried about you gaining weight.
Yes.
And what do you think about that?
Well, I'm worried too. I don't like it.
Uh-huh. So you're gaining weight. How do you feel that? How do you feel the weight?
Well, I had to buy like all new clothes for this school year, and that was a little bit painful.
What was painful about it?
I couldn't buy what I wanted, and I had to get bigger sizes.
Right. You remember what it was like being a smaller size, and that felt better. And so you feel like your appearance is better when you have less weight on.
Oh yeah.
Uh-huh.
Yeah, and then I can't wear the kind of clothes that all my friends are wearing.
Uh-huh.
So I feel like I'm wearing clothes like my mom instead of clothes like my friends are wearing.
Yeah,
because of the
you're
size.
getting old faster than you wanted to. Welcome.
So I should be wearing mama clothes.
Yeah, yeah. So your mom's been on you about this. You don't like it.
I really think she's trying to help me.
Okay.
But we're fighting about a lot of things, but that's not one of them. So that's good.
You're both in agreement about
I think
this,
so, yeah.
and it keeps happening. You continue to gain.
Yeah, and I asked her, she's out in the waiting room, but I told her that this is on me, that I'm the one that has to do this. So I asked her to wait in the waiting room.
Yeah. So what are your thoughts about what's going on with your weight, with this?
Well, I know it started this year when I started taking all the AP classes and college classes that, my workload for school is just overwhelming.
Yeah.
So I know, and I've been eating when I'm studying, and I'm studying all the time. Like, I feel like that's all I ever do is study. So I'm eating when I'm studying, and I'm not doing the activity like I used to. Like, I ran track in middle school, so I did some kind of activity almost every day. Yeah. If I wasn't on track, I was lifting at the gym. Yeah. So I did something every single day.
Yeah.
And
it's a timeout.
Okay.
Wouldn't it be great to have every patient be like this, right?
Am I being too easy again?
No, it's wonderful.
Oh, I'm being real. This is
but
real.
I just want to think of the OR skills: open-ended reflections, open-ended questions, reflections, summaries, and affirmations. The affirmation is the most powerful, and it's the one that's used the least. So if you're watching this on tape or live, think about, how could we affirm Judy right now, given what she just said? I'm going to give her a bunch of affirmations right now because I'm just so impressed. You really have a sense of yourself, and you really have a sense of what's going on with this increase in weight. You're doing these AP classes, and it sounds like the AP classes are really stressful.
Oh, I don't even feel like myself.
Right. You don't even feel like yourself. And it takes a lot of time. You're spending a lot of time studying. You don't have time to be as active as you used to be. And you're eating while you're studying. So it's kind of three things at once. You're kind of eating while you're studying. You're studying more than you used to. You're not as active as you used to. And there's something about the stress of this that's also
I think so.
Yeah.
Probably.
Yeah. And tell me more about this. What's important for you about these AP classes? How did you decide?
Well, I want to go to medical school. So I have to take the AP classes that's going to help me get, my credits in my first year of college, so I can take the courses that I need to study.
So you're really, really driven, and really, you have an ambitious goal. It's a doable goal, and
I hope so.
You're on your way to achieve this. And there are some costs along the way you're discovering. Yeah.
Yeah. And then I'm just afraid that I'm going to look back and realize I didn't have a high school. All I did was prepare for the future, because my life right now is so much different than it was last year.
Yeah.
And so much different than my friends.
Yeah. So on the one hand, you have some definite goals for the future that you're striving for. And on the other hand, you have a sense that you're kind of losing some of your childhood, you're losing some of your teenage years, and it's already showing up in your body.
Yeah.
Yeah.
That's exactly right.
Yeah. So you have this really great awareness of how the weight has happened. And I'm just kind of curious, it causes you pain in terms of your fashion sense. It was expensive to buy those clothes. You look like your mom. You're feeling like your mom.
Yeah. Looking and feeling like my mom. That's not what I want to do in high school.
Yeah. What else don't you like about the weight?
Again, it just doesn't feel like me.
You don't
Yeah.
recognize yourself.
Yeah, I just don't feel like it just doesn't feel like me. And I want to be my old me. I want to get back to my old me.
Right. You want to figure out how to be your old you and
Still take these AP classes.
right. Yeah. And right now you haven't found a balance between the two.
No, I've been trying, and but it just nothing sticks.
Yeah.
So that even makes me more frustrated because I'm failing.
Yeah. When you say you've been trying, what do you
like, just trying to do stuff on the weekend with my family, or,
Okay, so let's do a timeout
Okay.
here. So, right. So we see how she started to run to third base. When she said, I've been trying, she's going to tell us the plans, the things that she's tried that didn't work, right? Just by hanging out with her inner motivation, mostly what she has is pain. She has pain about gaining the weight. She didn't want to gain the weight. She doesn't recognize herself anymore. She's got this ambition. So here's the ambivalence. How do you find the balance there? She's not sure. When she says she's been trying, she's describing as the third base. I want to find out what has she tried, and then we'll see what else is left. Yeah.
And, a lot of these statements are straight from my patient's mouth. And it's the ones that I hear over and over again.
Yeah. So what have you tried? You said you've done some things on the weekends with your.
Yeah, my dad goes hiking, so I could try to go to Canal State Forest with him and hike and take the dogs for walks and whatever.
And what's that like for you?
Oh, I love it when I do it. I just can't, so many times he'll say, do you want to go? And I'm like, I can't, I've got too much to do. Maybe I'll go after I get this done.
Yeah.
But then it's dark and cold outside.
Yeah.
So it's just like I can't win.
Yeah.
I just can't win.
Yeah. You're really driven.
Well, I'm apparently not, because I'm not succeeding at this, because I really have tried to get back into the routine of doing something every day, even trying to start really small.
Yeah.
And I just can't seem to do it. And I just can't do it.
Yeah. Yeah. Right now you've made the grades the priority.
Yes.
Right. The grades are more important to you than your own health.
Well, no, I don't think that's fair. That's why I'm here. I want to be healthy too, but for somehow I can't do both.
Right. That's what I mean.
Yeah.
So when you can't do both, which side are you giving priority to?
But see, that makes me feel really bad, because it makes me feel like I'm not doing what I need to for my health.
Which is a very true statement. That's what your body's telling you, right?
Yeah.
That you're not taking care of.
And this is where I cry.
I see that. I see that tears coming.
This is where the patient cries and said, I just can't do both. And I need help. I need you to help me figure out how I do both.
Right. She wants me to, she wants me to fix a problem that she's behaving herself into, right? Can't you give me Ozempic or something like, can't you give me some pill that will take this?
No, I didn't ask for a pill.
No, you didn't. You
Okay.
didn't. No, but this happens in medical things all the time. People come in with wanting you to solve the complaint that they behave themselves into, right? Because I'm not going to take responsibility for what you're doing to yourself. Right? I'm responsible for the quality of this conversation. I'm not responsible for.
Do you ever say that?
Sometimes.
I do too.
Right, because you're pushing on me to.
I'm pushing on you to go into that intervention model.
Right.
And that's what I have a lot of adolescents do to me.
Right. And so we could get into a tug of war, but I don't want to pick up the road. So I'm just going to go into your sadness here and say it's incredibly sad what the bind that you find yourself in right now.
So one of the things there, that is an amplified reflection, right? Because I never really said I was sad. I said I was
tearing up.
Anxious, but I started tearing up.
Yeah.
But you put the sad word onto that. And I think that's a skill that when I've observed folks trying to do motivational interviewing, that they don't easily do and make it to that step. Maybe because they're afraid of those words, to put emotion on the statements they're saying.
Yeah.
But to me, when I'm interacting with my patients, that's the next step that I feel like, okay, now we've bonded. Yeah. And now we can work on this together.
Can I let the person feel some of the suffering of what they're doing to themselves?
Yeah.
Right. So And yes, so I'm amplifying the sadness. I'm
Absolutely.
saying it is sad what you're doing to yourself right now. And we could say this is a developmental challenge for a teenager. I want to do it all, right? And so, part of the maturational process is learning I can't have everything I want. I've got to give up something.
And we see this
here.
on the other side with our athletes that are practicing and trying to make it to the gym for their athletics, and then their grades drop. So it's that same double-sided edge, double-sided sword, but it's for different reasons. Right.
And it's going, so if we can go back. So both of these things are important to you. You didn't like it when I said you're making the grades the priority.
No,
because
because my health is a priority. It's just important. If I don't have my health, it's not going to matter what my grades are.
Well said. Right. They're both really important to you.
Yes.
And right now they're out of balance.
Yes.
And your body's telling you, right, that you're using food in a way that's not healthy for it. You're using food because you're kind of bored when you're studying so much.
I think more anxious when I'm studying and more stressed. Yeah. Right.
And then
because I've definitely eaten out of boredom before.
Yeah.
But it also keeps me awake.
Yeah. So this goal is, and the grades and the worry about the grades is causing a lot of stress. Yeah. Yeah. And eating is a way to try to relieve the stress. Right. Yeah. What do you want to do about that?
I really feel like that if I could get back to my exercise routine, it's going to help my energy.
I bet you're right.
And my weight.
Yeah. Yeah.
But I've been trying to do that and it's just not working.
Yeah. You start to tell me that you were on weekends, you go up hiking with your dad and you love that and you're actually able to get away and do that.
And I feel better and feel like I concentrate more when I come back and study.
Oh, I bet.
Yeah.
Right. That's sort of paradoxical, right? If you give yourself more breaks, you study better.
Yeah.
I think the same thing is true with sleep, right? If you get more sleep, you retain more.
Right.
But
well, and that's the other thing. I'm not getting much sleep because I'm staying up late to study for tests.
Right.
And the tests are so much harder.
Yeah. Yeah. The AP stuff is so much harder. Yeah. So you say you can't figure out how to balance this, and it is hard, right? I mean, there's nothing easy about what you're trying to do here. So what other, you found a couple things that have worked, like this thing on the weekends. When you say it doesn't work, what describes to me what you mean by?
Well, I wanted to do something every day.
So that's a goal that you have for yourself.
Yes.
And that goal.
And I'm very frustrated that I've just not been able to do that. Like I just haven't, it's just not worked.
Yeah. What happens?
I just don't do it.
Oh.
I just feel the pressure to study.
Yeah.
And it wins.
Yeah. Yeah. And how would that be for you to be a physician whose weight is out of control? If we were to just kind of project this, you're 5 or 10 years or 15 years ahead.
Yeah, probably not good, because why would my patients listen to me if I can't do it myself?
Yeah. 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 And any other thoughts about what that would be like?
Not really.
Yeah. So, and what wouldn't be good about that? It would be like,
I don't know. It seems like hypocritic to me.
Hypocrisy. Yeah. That's funny, right? You're stressed out. You're eating because you're stressed out because you want to go into the health field.
Yeah. Pretty much.
What else so I'm going to go into an ask off or ask here. What else do you know about things to do that relieve stress? You certainly exercise. Relieves stress. Plus,
and that's what worked for me before.
Yeah.
So that's
right. So you've been relying on something that used to work, but now it's a new situation.
Yeah, I think it would still work if I could just do it.
If
but
you were
that's
willing,
the only thing I've really done in the past.
If you were willing to give yourself time for the exercise, it would work again.
Yes.
The problem is you don't give yourself time.
Right.
Yeah. What else do you know about other ways to help relieve stress?
Some of my friends do an app, breathing thing, but I don't.
That's not for you.
I just don't think so.
Yeah. Yeah.
I don't know.
Anything else you've ever heard of that can help with stress?
Going to a therapist, but if I don't have time to exercise, if I had to pick between exercise and going to therapist, I'd much rather exercise.
Yeah, yeah. And so what is it that you tell yourself about the AP classes and that you're working so hard? Can you just help me understand what's so
just to get into medical school and get the career that I want,
and then to get
be successful.
And to get into medical school, does that mean you have to get all hundreds? You have to get all A's? Or
yeah, you sound like my mom.
Yeah, in what ways?
Well, because it is very competitive. So yeah, I do feel like I have to get all A's.
Yeah. And that's where the rub is, right? Because that just drives you to keep studying and keep studying.
And I guess you're right. I didn't like it when you said that I wasn't prioritizing my health, because I really do, but my actions aren't supporting that. And I know that.
Well, and it's really fine because it's your life, right? You get to prioritize your life however you want to.
So I need to prioritize the exercise more over the grades for just a little bit to get back in that routine.
If that's what you want to do, right? You're pretty confident that if you were exercising more, you'd be losing the weight and you'd be feeling better.
Yeah.
Right. You're just not sure if you can kind of let the death grip that the AP classes have this death grip on you.
Yeah, they do. You're right.
Yeah. So you have some things that work. They worked in the past. You're pretty confident they would work now. It's a matter of finding time, and time management is self-management.
Okay.
Right. So how do you manage yourself?
Okay.
But again, this is your choice. This is your life.
Well, I think I need more time management then. I mean, I didn't think about it as a time management thing. To me, it was that I'm just always thinking about studying.
Yeah. So the voice that says you're looking like mom isn't that strong.
Right.
Yeah. So we're just about out of time. What's your takeaway from this today?
So I need to figure out a time management plan that I can do some kind of activity before I start studying.
Oh, that's interesting. So you would do it before you started to study?
I'm thinking about on the weekend, you know what I mean? Like when I study, then when my dad asks me to go hike, I take that break, and then I do so much better when I get back. So that if I could do it before I start studying, maybe I can be efficient and get more done, and I wouldn't have to stay up late.
Right.
I don't know if it'll work or not.
Are you sort of saying, I worry if I'm not studying?
Yeah.
So if I do the exercise or whatever it is before I study, it's like getting to study is the reward, even though it's very stressful.
Yeah, studying as a reward. Who ever thought about that?
Is that different from what you've been doing? Because you
Yeah, because what I've been doing is hitting the studying to try to get some done, but then it's like I'm spinning my wheels, and then I feel guilty that I don't then have the time to do it.
You can't disengage from the studying.
Yeah, so that would be something different.
Okay.
As soon as you said time management, that made me think of it in a little bit of a different way.
Oh, okay.
Yeah.
All right, great. Well, it's great to see you, Judy. Yeah. I look forward to seeing you again and seeing how this worked out.
Thank you.
So this is a long game, right? It's a relationship building game. She came up with an idea. She came up with the idea. That's the important thing, that she thinks is going to work better than what she had been doing.
Right.
And now we get to test and see what happens. How was that for you?
Very different than my usual experience, right? Because if I would stall, I think that the provider would have already offered advice of what I needed to do.
Like what interventions?
Like, well, you said you want to exercise, then you just need to do that. Come back in 2 months.
so then we've got to.
Yeah. Well, you said you need to exercise. Well, that's what you need to do.
Yeah.
But I just told you that didn't work.
Yeah.
So it's when you added that time management that gave me kind of a different flair.
It's like that saying here in West Virginia: if a hammer doesn't work, get a bigger hammer.
Yeah.
Right.
Well, but I
So-
think
so
that's
maybe
what we do as providers,
That's
where the MI is that you just kept asking me questions until something triggered me into that.
I wasn't going to take responsibility.
Yeah,
for
and
the
I guess that's what
outcome.
we do. And that's one of the
Uh-huh.
things that I think when we talked a little bit last time, that I've been doing weight management for almost 20 years now. And in the beginning, every time I would have clinic, I would not sleep the night before because I'm so worried about who's going to come, who's going to show up, are they going to be meeting their goals, what is their outcome?
Wow.
And it was so much pressure, and that drained me for so long to the point that I almost just didn't keep going. And it was when I learned motivational interviewing that I learned that's not my role, that's not my job, and that my job was to be that coach and to be there to help them,
Yeah.
but they were holding the bat, right?
Yeah.
And I think that you found an article that was very similar to that. And Summer, if you could go ahead and put that article in the chat. Do you want to talk
Yeah,
about that as
This
in
is the article
closing?
about burnout
Yeah,
in
medicine.
in the health.
And I think that would be a great way to end this 2 series on
Right,
motivational
we've got
interviewing.
so many nurses, particularly
Yes.
crisis and
Mhm.
social worker, crisis
Mhm.
and social worker.
After the COVID pandemic, even I think it was even the nurse crisis was even starting before that time, and then here comes COVID.
Right.
And
If I'm going to take responsibility for the patient's outcome, I'm going to burn out.
right,
Right. I'm
Mhm.
now stressed. I'm worried.
Mhm.
All of that. I'm
Can
not
you
exercising
imagine?
now.
Right? Can you imagine all the physicians and the nurses during COVID that they had 10 times more death than they'd ever dealt with in their career?
Yeah. So this article is about how motivational interviewing, particularly around childhood obesity, helps the provider to not take an ownership position of the outcome.
Mhm.
And that helps the provider to not burn out so that, I'm curious about what you're going to do with your life, Judy.
Mhm.
I'm curious about what you're going to do. I mean, it's admirable. You want to go to medical school. That's awesome. And you want to you're the same weight as your friends, and you don't want to grow up too fast. And it's sad that you're losing your
Mhm.
childhood. And both of those are true.
And all of those are reflections that I stated.
Yeah. And I'm really
Mhm.
curious what you're going to do with your life around this.
Mhm.
So then I just get to be a consultant to you on your life rather than a bigger hammer.
Mhm. Mhm. And we did that with the residency program when we first started doing this in Children's Medicine Center eons ago. I don't even want to tell you how long. We did a pre and post test survey for the residents to see if their comfort level with health and wellness management, and we did actually show that. So it looks like I should have written that up back then, huh? It was definitely a game changer for me to be able to help their patients and not get burnout.
Yeah.
And I think we all struggle with that at some point in time. I think that our personalities and why we went into medicine makes that part of who we are. But I think that it's a skill that not only helps our patients, but it also helps us. And I think one of the biggest issues, just like Judy had time with time management, one of the biggest issues for providers is the time management for the providers. So remember, this doesn't have to be done in one visit. It can be done in several visits, that you talk about the evoking and getting them to focus in one visit, and then say, well, I want you to think about these things, and we'll come back and we'll talk about it.
Or what are you,
or
what things are you going to think about? So we want to evoke those things that Judy's going to think about rather than tell her what she should think about.
Good point.
Right. And we didn't time that, but it was maybe 15 or 20 minutes.
Yeah, probably about 20 minutes.
One of the objections is, well, I don't have the time for that.
Mm-hmm.
And
you're just spending your time in a different way. You really are just spending your time in a different way, but you're going to get a result. And the old way, you're not going to get a result. And we know that.
Yeah.
We have definitely proven that.
It's a little bit more time up front, it feels like to me. Although when they actually time it out, some of the healthcare providers say, no, it's the same amount of time. It's just a complete, like you said, a completely different way I'm using my time.
Exactly.
Yeah.
Exactly. And the 5210 guidelines that anyone that has trained with me and Keys for Healthy Kids, this 5210 flip chart here, in it is in tab 15 is that 15-minute, I think it's tab 15. It is actually. Tab 15 is a 2-page, 15-minute, funny, it says intervention protocol, but all of the examples are how you utilize MI to run the basis, just like Scott taught us.
Yeah. Thank you so much for having me.
Oh my gosh.
This was helpful.
Thank you so much.
I'll ask Jamie to send out some information. I do twice a week, I do free practice groups. You're welcome to come to those. They're Mondays and Fridays at 9 o'clock. And so you don't have to register. Anybody can show up and we just practice. We do the kind of thing.
That is awesome. Yeah.
And, thanks so much for having me.
Oh, thank you. It has been so fabulous.
5, 2, 1, 0. Every kid, every day. Let's have fun in a healthy way. 1, 2, 3, 4, 5 servings. Fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. And let's go play outside. Tiger it, my turn to hide. 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day, let's have fun the healthy way. 5, 4, 3, 2, 1.